Thank you very much. I too want to thank all the witnesses today, and look, again, it's worrying, and I just want to ask Pobble first of all for, can you tell me more about the geographic identification of disadvantage? How is the data collected? Is it based on service users, or how do we know what is hidden? And I think that's important that we do realise that. And just again for Rialto, you know, we spoke about generational inequality and, you know, there are family barriers there. You know, some of them can be historic. But do you find that families now feel that because they're asking for help and it's very hard to maybe just get that support, and you're knocking door after knocking door, and then you feel that families get so disheartened? I mean, do you see that as a big issue? Maybe if that one could be answered too. But also just on the previous speakers, when we speak about the Child Poverty Action Plan, absolutely. And I'm just wondering, what is our best way to start that? What particular areas do you feel, you know, I mean, we all know about housing and families, you know, who are moving, as you spoke about, from maybe family to family, couch surfing, sharing a room, maybe in a hostel or B&B. Then we have to work through our local authorities. Then we have to make sure that proper payments are made, and that becomes an issue when you're moving around as well. So, for a Child Poverty Action Plan and all the groups together and getting everyone together, I mean, what way do you see we could start to make that change? Because we do really need to make change. And I even spoke today about, in my own area, where I know of families that have taken children out of school, good schools, and put them into other good schools, but they've taken them out of schools because there's no hot meal programs in it, because they want their children in schools where there's hot meals programs. And also, even I see it myself now, Christmas is coming, and we see with children, it's such an important time. And, you know, there is families there that look for food parcels, or maybe hope to get a parcel, maybe, you know, and it's you know, we need to work with families and children that need that support, and we need to do it more. So I just see these issues myself in my own area. But again, I just want to thank everyone. You know, we all have to work together, and, you know, we have to make sure that we make that change. Thank you. Thank you, Cathaoirleach.
Thanks, Deputy. So sorry, Ms. Kiernan, I know you've had your hand up, so I'm going to go to you first, and then Pobble Rialto, and then I think there was a question there as well for the Women's Council. So Ms. Kiernan first, please.
Thank you. I just wanted to go back to the issue around the National Child Poverty Action Plan. We had mentioned it in our submission. There is an opportunity, as was mentioned there, with the EU Child Guarantee. That is going to be something that we can politically focus on and develop a plan. It's unclear how much funding will be available for that, but it's not hugely significant. There is a need and an opportunity to have a broader whole of government Child Poverty Action Plan. And I suppose that's where we're saying there is a possibility then, when you have a national plan in place, then to look at local implementation structures. The ones that are used for children at the moment are SIPSIs, so they could be very useful. And I suppose the kinds of recommendations we made in our submission, we were saying most poor children live in one-parent families. Focus on them. The EU Child Guarantee also talks about very marginalised families, Roma, traveller, ethnic minority, children living in direct provision, very, very marginalised children. There's an opportunity to do something for some of those children by focusing on specific target groups. But you also need those structural national policy barriers removed. So making work pay for lone parents, letting them get into education, letting them keep child maintenance, or making sure there's a system for that to be paid. A lot of the problems are at a national policy level and needs to be resolved at that point. So we would say get that bit right and then look at how things can be improved at a local level. But people need something to work with, and they don't necessarily have it yet. Thank you.
Thanks very much. Ms. Shakespeare or Dr. Rogers from Pobble?
Thank you, Cathaoirleach. I think the question was around the deprivation indices, and just to advise that the index is commissioned by Pobble every 5 years following the completion of the national census, and it's used by state agencies for the geographic identification of disadvantage, and is primarily used to help target resources towards communities that are most in need. So the index, to answer the Deputy's question, uses a series of data points from the census to, I suppose, suppose, established levels of disadvantage under three domains. So demographic profile, social class composition and labour market situation, and gives a rounded view of the lived experience of disadvantage beyond simply measuring income and poverty. So the resulting index provides a deprivation score of between +50 and -50 for every small area. And we have used it, as have other, parts of the state infrastructure. For example, in resource allocation modelling for the SICAP Social Inclusion Community Activation Programme, the LEADER Programme, the City and County Childcare Committees, and most notably as a key input into the DESH identification model used by the Department of Education. And schools' designation as DESH, as all the attendees would know, is considered a key factor in the school's eligibility for DSP's Hot Schools Meals programme. And then in the context of the commitments contained in First 5, so very much at the heart of this strategy for babies, young children and their families, we're currently providing technical expertise to the Department of Children in relation to the potential application of that index as part of the model for identifying early learning and care settings who have a high concentration of children who come from disadvantaged backgrounds. So rather than the geographic location of the early learning and care provider or centre, that we use the locations from which those children come, those babies come, as the mechanism by which the core funding might be established around that. So I hope that's of assistance to the committee.
Yeah. Hi, how are you? Sorry, I've taken over from the chair at the minute. Miss McKenna, did you want to come in on that question?
Hi, it's Gillian here from Reality Project. So I'll actually come in on that question, if that's okay.
Yeah.
So I suppose just in relation to, do families feel that it's difficult to access or ask for help? I think that was the question that you were asking, Jennifer. So in terms of our experience, I think that it can be really challenging for families to access help. We're, within communities where there's multi-generational educational inequality and poverty, and with that, the very real experience of isolation and shame that can be further marginalised families and make it really difficult to access services that are there. We really believe in community-based services and projects like our own, because we're based within the community. There are long-term relationships within that community where we can build. We work in a solidarity approach, that we're working alongside children and their families with that community development piece. So really looking at how we can challenge those inequalities with families. I think that people and communities really do feel a failure of an action by the government in terms of tackling poverty. There are very real and very tangible issues around housing, health, meal poverty, poverty, food poverty, very real things, as well as the stuff that we talked around, the longer issues around education and that. Within the homework club that I'm based in Dolphin House, a hot meal is a really important part of the service that we have here. It's part of children's social development, but there's also a very real need in that sense as well. So for us, it's about those kind of long-term sustainable support for community-based organisations like ourselves to really tackle that. I mean, the effects of income poverty are linked to health inequality, children experience more ill health, housing, labour market disadvantage. And we see that children in poverty experience quite a multiple and cumulative disadvantages that are inextricably linked to all of those things. And that parents who have access to resources are able to support their children for things like school readiness, which are really important in terms of that long educational journey for children.
Thanks very much. I think Ms Foster-Breslin, did you want to come in?
I did. We have had, I wanted to mention, how our parents were affected during COVID, and how this has, how we have seen firsthand how this affected women and children. And I wanted to mention the Sutton Trust, a UK charity, released a report which found that 57% of pupils in private and secondary schools and 30% of middle-class pupils participated in daily online lessons, but only 16% of pupils from working class families participated. We need to continue to invest in a community-led recovery from the consequences for vulnerable children and families of the pandemic. Very fragile families in difficult circumstances need our national government to ensure on-the-ground responses. Many of my other colleagues have already mentioned that the way to do this already exists through our community organizations, and we are poised to act if we are properly resourced to do so. We must invest in our social and community providers to offer real-time, responsive support to help our children and communities recover. Otherwise, COVID will just be one more wedge that separates the haves from the have-nots and grows the gap in life chances amongst children of different backgrounds from their earliest years. We already have what it takes. We just need to be properly funded.